Hello and welcome to your next unit. This unit is CHCCOM005, Communicate and Work in Health or Community Services. Okay, so we have certain ways that we can communicate. This can be either through verbal or non-verbal communication. So it can be spoken words, informal or formal speech, differences in tone, volume and speed. This can also be done through non-verbal communication. So this is through our gestures and our body language, our facial expressions. It can also be done through cue cards or a picture board. So models of communication. So we follow the who says what, in which channel, to whom, and with what effect. Service information. So this may be a simple communication of appointment times or directing people through to a service. You may handle patient-client information that is confidential and vital to the care that they may be receiving. Improving your communication. So the saying goes, we can hear what you're saying, but we're not listening. So what we need to do there is we need to change it to be active listening. So this is where we're actively taking part in what we're being communicated with. How we do this is by relaying information back to our client so that they can see that we have a clear understanding of what they're trying to communicate with us. Check that understanding has been made. We can do this by asking if the information has been understood, checking if further information is required, repeating key points, encouraging a discussion to confirm that understanding has been made, and by providing support within a written information. How we get as much information out of our client as possible is by asking open-ended questions. So these are questions that we ask that the client cannot just answer yes or no to. It makes them have to give us more information. Listening to others. Reflecting can be performed through mirroring or repeating back what the client has said to us, or paraphrasing. So this is using our own words to repeat back to the client that we have the level of understanding of what they've been trying to communicate with us. Collaboration and confrontation. So collaboration is the coming together of two or more persons to work together for the mutual benefit of all involved. Yet confrontation is where two or more persons who come together clash and disagree over a certain subject. Confidentiality of communication. So we need to be aware that we maintain confidential information that we've been told to by our clients or our organisation, and that doesn't go outside of the organisation. We also need to use a private room to discuss any information that could be confidential. We ensure that the recipient is cleared to receive any of the information that we're telling them, and we only disclose necessary information. Client records. So we need to maintain privacy and confidentiality when it comes to our client records. So as I've mentioned previously, this could be through a password protected computer. This can also be stored in a secure locked up cabinet, which once again, only authorised personnel will be able to access. Apply workplace protocols and procedures. So we need to clarify what we need to do. And so this is what the task needs to be completed, when the deadline of the task is, the sequential order of the tasks, the expected length of the task, documentation requirements, required equipment for the task, and required safety precautions. Working with other sectors of the industry. So some example of other sectors in the industry could be general practitioners, physiotherapists, occupational therapists, diversional therapists, dietitians, nutritionists. So once again, we are only going to disclose the type of information that that particular service requires to be able to meet our clients' needs. Organisations in the healthcare system in Australia. So some of these organisations could include public hospitals or private hospitals, health professionals or private practitioners or your general practitioner, clinics, government agencies and non-government agencies. Industry terminology. So it's a good idea as a support worker to familiarise yourself with medical terminology that we use within the industry. You'll be able to pick this up once you go out and start to complete your vocational placement hours. Otherwise, you can ask your trainer to give you a list of used phrases in the industry in the aged care sector. Friendly communication. So all communication with our clients should be one of which is a friendly matter. How we do this is by using the pitch and tone of our voice and matching that to our body language. Identifying the problems in your area. If you do identify a problem with the communication of your client or their advocate, I suggest that you go to your supervisor and let them know of what the communication problem may be, and they'll be able to give you further techniques on how to get around those little issues of communication with that particular client. Health issues for Indigenous Australians. So factors contributing to Aboriginal and Torres Strait Islander people's health could be the history of European Aboriginal contact, loss of culture, land, identity and Indigenous laws, loss of family links, geographical remoteness and many more. Personalised communication. So communication requirements can vary greatly from one individual client to another. You may have one type of relationship with one client where there's more banter involved and more joking around, yet another client might be more serious. So the way that you communicate between individuals is really important to understand what your relationship is and what their background is. Cultural differences. So here we want to minimise our jargon because our jargon is different between each culture. So what I mean by jargon is the use of slang words. We want to try not to use slang words while we're communicating with your client, and we want to communicate with them in a respectful manner. Therefore, we use their preferred name. We don't use pet names such as love or sweetie or princess. We do understand that there has to be a level of respect there, so we do use their preferred name. Facilitate resolution of issues. So how we can do this is by using, once again, the pitch and tone of our voice. If we find that we're having a communication issue and we're finding that our voice is getting a little bit higher and getting a little bit louder, we need to check that we're going to bring that back down to a reasonable tone and a reasonable pitch to our clients, because if we're starting to get frustrated, that's only going to frustrate them further, and therefore the breakdown of communication will become greater. Conflicts of interest. So different areas of conflicts of interest could be things like personal relationships, political views, religious views, financial interests, cultural activities or cultural views, and private activities. So this could be a relationship between one client and another. Code of ethics. So as you may have heard, I've discussed code of ethics in a previous unit. This is a set of moral principles and standards that you use to guide your practice in a particular professional manner. It is not a legal document, but it's more a voluntarily set of guidelines and morals and rules that you tend to work by. Reporting issues. If you do identify that any of your clients have any type of changes, whether it be physical, mental, psychological, social, this is where we need to take those observations and changes to our supervisor and notify them of what you have observed. We're also going to document it down in the individual client's progress notes as well. We're going to see if there's going to be a pattern forming over a period of time so that we can try and resolve these issues. Working alongside others. So you're going to work with a cultural diverse range of colleagues, and you need to be respectful to not only your clients' cultural backgrounds but also your colleagues. This could be anything from clients to community organisation, client families and caregivers, friends, peers and government representative or service providers. Resolving conflict. So to resolve conflict, we need to work out what the underlying issue is first. Once we have identified what that underlying issue is, we can then start the conflict resolution. it is a good idea to bring in a third party or a mediator, or even use your supervisor if you're having any type of conflict between yourself and another colleague, and you can sit down in a private environment, discuss what the issues are, and have that third person there to be able to keep it calm and to be able to resolve the issues in a professional manner. Completing required documentation. So this includes your healthcare records, making any appointment bookings, service documentations or forms. So this could be, for example, behaviour charts, input-output charts, could be a urinary chart, reports on services, reports for transferring. So if we need to transfer any of our reports from one organisation to another, there is a certain protocol that you need to go through to ensure that the confidentiality and the privacy of said documentations is maintained. The outpatient clinic records and also care records. Reading and understanding documentation. You will need to have a well-rounded understanding of being able to read these documentations that are included in your client's care. These documentations could include claim forms or patient-client records, medical or health records, medical stores documentation, certificates, or care reports. Completing workplace documentation. Always follow your organisation's policies and procedures around completing workplace documentation. Once again, if you come across a medical record or a document that you haven't filled in previously, go to your supervisor and ask for some assistance so that you don't make any mistakes. Digital media. So these are the things that we can use to give our client further information. So we could get things off the internet or the web. We might be able to get brochures that are emailed through from community events. We could use podcasts and videos, and we can show this information through tablets or iPads to our clients. Choose your words carefully. Before you go in to speak to your client or their advocate, have a bit of an understanding of what you're going to say prior to going in to speak to them. You don't want to be going in and fumbling your words and display that you don't have an understanding of what's happening with that client's service or the care that they need. Values and philosophies. So this may relate to a holistic or a person-centred approach, promoting the well-being of not only your client but your staff and colleagues as well, early identification of problems and the delivery of appropriate services. Improved work practices. So this is enhancing the outcomes for the clients, it's enhancing sustainability of work, and it's enhancing safety for staff and the clients and their advocates and family and visitors that come to see them. Personal values and philosophy. So this could be anything ranging from the type of standard of care that you as a support worker want to provide your clients. It could be the ambition that you have, the drive that you have to go there every morning and try and put a smile on your client's face. It's being diligent and efficient within your work and doing your work in a timely manner. It's having focus while you're at work and that your mind is at work and not somewhere in your personal life. The best way you can get some feedback is to ask those that you work closely with. You will tend to work with a group of people on a day-to-day basis, and it's those people that you can ask for some constructive feedback on how you're working, how you're communicating with not only your clients, but with them as colleagues. You are more than welcome to ask the clients to give you some feedback as well, letting them know that you're wanting to improve your standard of care, and for them to give you some feedback. It's going to provide you with what you're doing well and what you're not doing so well and that you need to improve on in future. So once again, once you've gone through your PowerPoint presentation and you've gone through your learner guide, you will come down to your set of questions that you will be required to answer. These will consist of skill assessment, knowledge assessment, and performance evidence assessment. Once again, if you have any queries, qualms, or questions, please feel free to contact your trainer directly and they'll assist you in any way possible. Thanks for joining me again, guys. Bye.